Hi, everybody. Mary Ferguson-Perret here, and I'm at the Toronto Western Hospital Bariatric Clinic, a brand new endeavor over here, and I'm with the interdisciplinary team, or some members of the interdisciplinary team, and one of our clients who has come through the program. And this is a very, very exciting and important program. And I want to begin by asking Linda if she would just sort of tell us a bit about it. And then we're going to hear from Lorraine about the dietitian's role, and from Jairo about the social worker role. And then we're going to talk to Jim, most importantly, about what this means to patients. So Linda, tell us about this program.
Well, the bariatric program has really been in place here at Toronto Western Hospital since about August of last year. We've started taking in patients. Our first surgery was done November the 16th, and with that, this is a ministry initiative that we're trying to meet the needs of our citizens here in Ontario who are suffering from a chronic disease known as obesity, from which stems multiple other comorbidities such as diabetes, congestive heart failure, obstructive sleep apnea, also cardiac illnesses, for which when we do this particular procedure, what we're finding is many of the patients who suffer from diabetes end up having the diabetes eradicated within days, if not shortly after surgery, so weeks out. So for many of our patients, not only are they for once being able to now lose the weight, keep the weight off, but they're also resolving a number of the comorbidities that are actually contributing to healthcare needs, and hopefully we're saving healthcare dollars in that process.
So you're causing miracles to happen, I'd say.
That's what we'd like to believe.
Well, listen, let's hear from our dietitian here, Lorraine, about how do you contribute to this process?
Well, the dietitian obviously is a member of the team along with many other people, but our job is to assess patients, and so that we know what they're doing now and how their diet will have to change and what they've done in the past to try and lose weight. All of our patients have had other diet attempts. This is not the first effort to lose weight. The surgery is a tool to help them lose weight, and so we educate them around how their diet will have to change after surgery, and it is significant. And there are nutrition complications that they have to be aware of. All of the patients have to take vitamin and mineral supplements for the rest of their life. And so it's very important that they understand what's involved with eating after surgery in order for them to be successful.
And I imagine for any of us, it's a big change to just start eating differently. But I imagine sort of there's healthy eating is very important here.
Obviously, we want them to eat a very nutritious diet after, because the volume of food is really low. Everything they eat has to count from a nutritional point of view. So we don't want them filling up their new stomach pouch with food that is not nutritious. So there's quite a bit of education around that and follow-up.
And that good advice would probably be for all of us, I would say. But thank you. And social work, how does social work get involved?
A very important part of this program is the psychosocial assessment, the psychosocial component. We have two psychiatrists, we have a psychologist, we have a psychometrist, and myself. And we look at how people live their morbidity and how it affects through the years. Obese people tend to be disenfranchised in our society, and they come with a history of depression, anxiety, bullying, abuse, and we take everything in context to help the person deal with the emotional aspects. Then there are other psychosocial issues. We have many people who have been in a disability for many years, who have very limited income, and we need to address those issues of housing, issues of also the support that they require. Part of my role, besides doing the initial assessment and doing the follow-up later, is to provide a group psychotherapy support forum, and we have been running it for people And we are mixing now people who are about to have surgery and people who have had the surgery, so they can share their experiences and normalize what are the difficulties and the challenges that we have. So in a nutshell, we do a comprehensive ecological approach, the individual and its environment and its immediate support. And it's the only way that we can ensure that the quality of life that we are looking at is there in a permanent and long-term basis.
Wow, that's fantastic. And I'm really keen to hear from Jim about, you've been through this process, Jim, and can you tell us a bit about it from your experience?
Yes, I had my surgery at St. Michael's Hospital in February of 2010. At the time I went on the table, I weighed 305 pounds. Today, in May of 2010, I'm down to 235, so I've lost 70 pounds in approximately 3 months. I was a type 2 diabetic. I no longer take any diabetic medications. My high blood pressure has been resolved. My Lipitor use has been greatly reduced, so my cholesterol's way down. My blood pressure is 110/70 and a resting heart rate of 60. So whereas before I couldn't walk more than a half a mile, now I walk 5 kilometers a day. I swim every day at the Y, and I have a new wardrobe. It's the best thing that I've ever done for myself.
Oh, great.
And I must point out that this is a 5-year-long follow-up. So in the first year, you're seen 3 months, 6 months, 9 months, 12 months, and then annually for 5 years. And that's a much better deal than some of the other systems, because people need ongoing support. And the last thing I'll say is that anybody that's contemplating this surgery should go through this program, because everybody needs to be educated and find out, and that's a big part of what the team does here.
Wow, what a triumphant story, and congratulations on what you've achieved.
I feel really good.
That's great. And thank you all for helping Jim to get there, because I think it was a whole team effort, of which you are one of the most important players in that team.
Yes, I certainly give them all the credit. And the biggest thing that happens here is people resolve their diabetes, which means that down the road they're going to be less costly to the OHIP system. And that's one of the things that I think is sort of an underlying plan here.
Well, this is just fantastic. This all arose because Linda made a presentation at the Nursing Forum, and we were all just so impressed with this program, and it very clearly is a very patient-centered and interprofessional effort. And thank you all for this great work, and I'm sure that all of you will have found this incredibly interesting, and any of you, as Jim was saying, who may know people who could benefit from this program, please let them know. So that's it for today. Thanks for being with us. Talk to you later. Bye-bye.